welcome home. So you had your ACL reconstructed today. This is a little video to go over what's written down on your post-op instructions so you can remember and understand and do everything properly. You have a brace on your leg that's only for walking. Okay, it's going to be locked the first week, unlocked the second week, but you only need it for walking. So when you get home, if you want to take it off, that's fine. If you want to sleep with it the first night or two, a lot of people find that comfortable, that's okay too. The unlock switch is over here. Right now, it doesn't bend. And then there's two switches on the side, which will slide up, hopefully, and then allow it to bend. Again, it's only for walking. So once you're home, you can take that off. Yours may be a little bit different, okay, but they all have this kind of seatbelt attachment. Once we set this up, you don't need to change the others. You just have to unhook and plug it into the seatbelt port. Underneath is a cold machine. Most of these are going to have actually open straps here, and this will be sticking out. Don't put it underneath the brace because this edge is sharp and it can actually cause some damage to the skin. When you get home, you're going to have three things on: an ACE bandage, a cold pad, and an ACE bandage. Leave those on for 2 to 3 days. In 2 to 3 days in the morning, when you're going to take a shower, you're going to do the following. You're going to take off the two ACE bandages and the cold pad, and you're going to save these and put them off on the side. These have Velcro on them as well, and it's easy to take on and off. And you're going to save these because you're going to use them again. You're going to see white cotton padding. You're going to rip this off. And there's going to be a loose pad up here and a little yellow strip which you can take off. This you're going to throw away. There's a waterproof bandage here with gauze pad underneath. Leave that on till you see me, unless water's getting in or you start to see a rash where the plastic is. If it is, take it off. But call me and I'll walk you through it. There'll be a little pinhole up here. Now you're ready to take a shower. You're going to shower. This is waterproof, so you're going to pat it dry. You're going to take a little bacitracin and a Band-Aid and put it over this little pinhole, and then the rest is just dried. You're going to take one of those ACE bandages that you had before, and you're going to put it back on. And you're going to start right over the bandage. Once around, and then you're going to go up 50%, not too tight because you don't want to cut off circulation, just enough to keep it on. And you're going to go up to one hand above your kneecap. Usually there's going to be a little mark over here where I wrote yes and my initials, and that's usually high enough. But most of it's actually going to go above the kneecap a few times around. And this is going to go in this position, one, to control swelling, but also so that your cold pad doesn't go directly on the skin. You're going to take the cold pad and you're going to put it back on where it was, but right on top of the ACE bandage. So you never want this directly on the skin. And again, it just sits on there. The cold pad then gets hooked up to this, okay? And this you're going to do actually when you first come home as well, when the brace is on, right? Because this piece is going to be sticking out of the brace. In here, it tells you where to put ice to and then water. This will stay cold 12 to 24 hours. You'll have to change ice at least once a day. So make sure you have ice at home, or you can get it delivered, or if you have an ice machine maker in your refrigerator, that's fine. And then what you're going to do is once it's on, you're going to plug it in, and you're going to turn it on. Okay? And that's going to basically rotate cold water through here, and that's going to keep the swelling down. Remember, swelling is the enemy of your knee after surgery. Swelling makes your quads weak, it loses motion, and it causes pain. If we control the swelling, you won't need pain, and we'll talk about pain medications in a moment. This stays on running all night long and anytime you're not walking around. Okay? So, when you're not using it after that third day, you can take it off or you can leave it on. Most people just take it off and leave the ACE bandage. Once the first ACE bandage gets worn or dirty, you're going to use the second one. By the end of that time, you'll see me in the office 2 weeks after surgery, and I'll change it in the office. If you control the swelling well and follow our instructions, most of our patients, about 95%, don't take any narcotics. Narcotics are great to block pain, but most of our patients don't have pain because we control the swelling. It's the swelling that hurts after surgery, not the actual surgery. Narcotics make you feel nauseous and constipated and you don't feel well. So the reason a lot of patients don't feel well after surgery is because of their narcotics. So we try to limit that. If you keep the leg elevated, slightly above your heart, so you'll actually put this when you get out of bed in the morning, you're going to go to a couch. You're going to build up some pillows so that the leg is going to be above your heart, so it's going to go back to your body to reduce swelling. You're also going to have the cold machine on most of the day. That controls swelling. We ask you to take 2 extra strength Tylenol when you wake up, 2 with lunch, and 2 when you go to sleep, 2 will leave with breakfast, 2 will leave with dinner, and by alternating pathways of pain relief and the cold and the elevation, most of our patients control the swelling and don't have any pain. We're preventing the pain from occurring, not chasing it after with narcotics. If you do have severe pain, you can substitute Vicodin for Tylenol in the same schedule of medication because there's Tylenol in Vicodin. So if you have severe pain, you can take 2 Tylenol, or if you have moderate pain, you can take a Vicodin and a Tylenol, or if you have mild to moderate pain or no pain, you take 2 extra strength Tylenol. So again, 2 extra strength Tylenol when you wake up, then 2 leave with breakfast, even if it's 10 minutes later, that's okay. 2 extra strength Tylenol with lunch, 2 leave with dinner, and 2 extra strength Tylenol before going to sleep. And using the cold machine and elevation, most patients do not need narcotics. If you do it, maybe the first day, but almost everybody doesn't take it after that. You will feel better. As far as the ice machine, again, all night long and anytime you're not walking around. Starting the first day, you can do some exercises. You're trying to get the quadriceps to work. Okay? Straight leg raise just means, go ahead. No, not too far. Just about 6 to 12 inches, right? So you're going to go up and down 10 times. Okay? Bending the knee, you're going to have the motion machine. We're going to show you that in a minute. But if you can't raise your leg the first day, it's okay to do heel slides. You just move the leg back and forth this way. And you're trying to get the quads to work. Quad contractures just means tightening the muscles. Go ahead and do it. And relaxing. All right? And you do that for 10 seconds. You can do 3 sets of 10, 4 times a day or less. The motion machine, which I'm about to go get, I'll show you in a second. This is the CPM machine, continuous passive motion. What it's going to do is bend your knee for you. It is important to do this the same day you get home from surgery while the block is done. Remember, the anesthesiologist did a femoral block here, blocking the nerves. That will last for several hours when you're home. When you get home, we want you to try to get anywhere from 70 to 90 degrees going up. This is easy, and it's been explained to you the day before you had surgery when it was delivered to your house, unlike the brace and the cold machine. This will be delivered to your house the day before. It's got a start and stop switch, and it's got a menu switch to add or subtract from flexion to extension. Okay? It's already going to be set up. You can set it up from 0 to 70, 80, 90 degrees, and you just hit start. And you want to do this at home before the block wears off. And you can increase the speed, but I'll do it in slow motion here. And again, you don't want it to hurt. So you go as far as you can without pain, up to 90 degrees that first day. If you can only do 40 degrees, that's fine too. Most of our patients get to 70 to 90. This is going to bend up and then go down. And I want you to do it about 2 hours that first day when you're home. If you do that, you will actually maintain that going forward. If you wait till the second day to do this machine, you may only be able to do 30 degrees. It'll take you a week to 2 weeks to get up to 90 degrees, adding 10 degrees per day. When you're going forward with this, on day 1, post-op day 1, so the second day that you're home, the day after surgery, you want to stop it when you're doing this machine 4 times a day, okay, at the maximum amount of flexion. By doing this, it helps the swelling get down, okay? So just let it sit there for 10 minutes, and then you just start it up again, and it'll move. The first day after surgery, and now you're using this machine, I want you to use the machine up to 6 hours a day. You do not have to do 6 hours. You definitely do not want to do more than 6 hours, but you can do it up to 6 hours a day, and you can break it up any way you want. You can do it all 6 hours at once, or you can do an hour here, an hour there. It doesn't matter. If you're too tired that day, you don't have to do it as well. That's the continued passive motion machine. When you're done with this, you take it off, put the cold pad on, ice the knee for at least an hour or so with the cold pad on, and then go about your day. As far as what you're going to do during the day, when you first wake up, again, you're going to take the extra strength Tylenol, and you're going to move out of your bed to a couch. I don't want you in bed all day. We want you on the couch with the leg elevated, using this machine when you're going to use it, and doing the exercise we talked about. There are 2 complications that can occur after surgery we want to prevent. One is called DVT, or a blood clot in the leg. If you sat around all day and did nothing, you can get a blood clot in the calf, and that's very dangerous. So we don't want that to happen. So once an hour, while you're awake on the couch, I want you to walk around the house for about a minute or 2, and then get back down on the couch. If you're too tired to do that, you can do 10 ankle pumps with both ankles, one or the other. It doesn't matter if you do them at the same or at different times, but you want to do 10 ankle pumps, which we will demonstrate right now. So just bring your foot up and down, and that squeezes the muscles in the back of the leg, and it simulates walking to keep the blood flowing. When you do those, whether you're walking around or doing the ankle pumps, I also want you to keep your lungs moving because you're lying down a lot. We don't want you to get pneumonia because the lungs aren't moving so much. So you want to take a deep breath and blow it out, or cough it out. Doesn't matter, right? Do 10 of those when you're either walking around for that minute or doing the ankle pumps, and you'll be fine. After your ACL reconstruction, you're going home with the brace on and crutches. You can weight bear as tolerated unless I tell you that I did a meniscus repair as well, and then you'll partly weight bear. Assuming there was no meniscus repair, you can weight bear as tolerated with the crutches and the brace locked at 0 degrees. It'll be set for you locked at 0 degrees. Once you're able to walk without the crutches, you can walk with the brace on, like Frankenstein, as tolerated. Once you can walk without a limp at home or in the office, you don't need the brace on as well. However, because it's New York and there's cracks in the sidewalk and people pushing and shoving, when you start commuting back to work, I do want you to wear the brace for the first 4 to 6 weeks while you're going back and forth or when you're outside. If you have any complications, you have really high fevers, having a lot of pain, or anything that seems unreasonable to you or it doesn't make sense because of what we spoke about, don't hesitate and call me directly. Call me on my cell phone. It's in your instructions. Call me even if it's 2 in the morning. I'd rather have a silly question at 2 in the morning then have a problem later in the day because you didn't want to wake me up. Okay? If you can't get a hold of me, you can get a hold of Tom in my office. If I happen to be in surgery, most of the time, just call me directly. If it's not urgent, you can email me questions, and I'll answer them in the order that I receive them.